The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hey, this is Jonathan Marks from Go to Health Media. I'm proud to announce that we are adding a new dimension to our show. For our first 100 plus shows and our first 1 million downloads, we have focused on human health. But in future shows, we will also be including evidence-based content and interviews on animal or pet health. So many of us have pets who are part of our families, and their health and wellness is such a huge part of our lives. So today we are talking about canine parvovirus, an often fatal puppy disease, which affects over 300,000 dogs each year. The virus is spread through contaminated feces and environments. Parvo has a staggering 91% mortality rate without supportive care. However, only 44% of us, according to a survey, are aware of this disease and symptoms. There's actually a map called the Parvo Track Map, which shows the current number of parvo outbreaks broken down by state and county. It's provided by our guest today from Elanco Pet Health. That's Elanco, Elanco Pet Health. This sounds just like the measles in people. Canine parvovirus has the highest reported outbreak rates in 7 states, according to new data from Elanco Animal Health. Some of the states with the highest reported cases of canine parvovirus include California, Texas, Arizona, Georgia, Florida, Illinois, and New York. But just because your state isn't on the list doesn't mean your puppy is not at risk. For the second annual National Parvo Awareness Day, Dr. Chris George, a veterinarian and infectious disease specialist with Elanco Animal Health, is helping spread awareness in support of the goal to defend puppyhood. Dr. George is a veterinarian and medical affairs specialist at Elanco Animal Health. He earned his DVM degree, Doctor of Veterinary Medicine, at Kansas State University. After residency, Dr. George moved to the Pacific Northwest, where he practiced small animal internal medicine in the Tacoma and Olympia areas prior to joining Elanco. Elanco Animal Health Incorporated is a global leader in animal health dedicated to innovating and delivering products and services to prevent and treat disease in farm animals and pets, creating value for farmers, pet owners, and veterinarians. With 70 years of animal health heritage, they are committed to breaking boundaries and going beyond to help their customers improve the health of animals in their care. You can learn more about Elanco and stopping parvo at stopparvo.com. That's stopparvo.com. So welcome to the show, Chris George. How are you today?
I'm doing great, Jonathan. Thank you so much for having me.
Good. So tell us, what is parvovirus? Some of us have heard about it, but I don't think most people have. What is the virus and what are the signs and symptoms?
Yeah, so you're not alone. It's not as well known of a virus as we want it to be. Hence the National Parvo Awareness Day is April 22nd to help spread the awareness of canine parvovirus. So what it is, or parvo for short, is a highly infectious and potentially fatal disease of dogs. And now we can see it in dogs of any age, but it's most common in our young or unvaccinated dogs. So think puppies, right? Ages 6 weeks to 6 months are most susceptible to this disease. And that's where we want to make sure that we spread the awareness to help protect those most vulnerable family members.
Yeah, so this sounds so much like the measles outbreak. It's so important that people get their dogs immunized against parvo.
You're spot on. So that's one of the key messages here is that parvo is a preventable disease. We have highly effective vaccines to help prevent the spread of virus and help prevent these dogs from becoming infected. So if you do have a dog, make sure you work with your local veterinarian to keep them up to date on vaccines. Or if you do get that new family member, that new little puppy, make sure you get them into the vet to start their puppy vaccine series so that they're protected as soon as possible.
Great. And how is parvo spread?
So it's a gastrointestinal virus. And so it's spread through contaminated feces. So think dogs have to come into either direct or indirect contact with contaminated feces. So they don't have to always go and eat another dog's pile of poop, which I know many of our canine friends are guilty of.
Yes.
They could simply walk through a contaminated area and then lick their paws. Or you and I can even spread it. It can get on our shoes, our clothes, our hands. And when our pets lick or smell us, they can be exposed to the virus that way.
Wow.
So it's highly contagious and it can live in the soil for a year or potentially longer.
Wow. 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 And you protect your dogs from parvo. How many times do you have to get an immunization for your dog? Is it just once or is it once a year? How often do we get it?
Yeah, great question. So in puppies, we do a series of vaccines to make sure that they're able to mount an appropriate immune response. And then from there, we typically do boosters about every 3 years. But I would definitely recommend that your audience go and speak with their local veterinarian because they're really going to be the best resource in knowing what vaccines and when to give them for their individual pet.
Great. So if a dog comes down with parvo, what are the treatment options? Are dogs savable? Can we treat them?
We can. And first, I want to take one step back because I think you had mentioned symptoms and I didn't cover that. So, before we get to treatment, let's talk about awareness. Owners should look out for symptoms of vomiting, loss of appetite, diarrhea, or lethargy, which is generally acting sick or tired. Those are all common symptoms of canine parvovirus. So if they do see any of those symptoms, that's a trigger to get seen by your veterinarian as soon as possible. Now, historically, we have not had targeted treatments for parvo. So historically, we just treated the symptoms while we let the virus run its course. So that involved intensive ICU care in a veterinary hospital where patients are receiving IV fluids, anti-nausea or anti-vomiting medications. But now, with Elanco's help, there is an innovative canine parvovirus monoclonal antibody treatment. It's the first and only USDA conditionally approved targeted treatment for canine parvovirus. So it actually treats the underlying disease and not just another symptom. It can really help these puppies feel better faster and ultimately get home quicker.
We'll be back to our show right after this brief message. Hey everyone, this is Jonathan Marks from Go to Health Media. We're so excited. We've just reached 1 million views and downloads of our 100 plus Go to Health shows on our website, YouTube, and 8 podcast networks. We want to thank all of you who have enjoyed listening to evidence-based health information from our wonderful health experts around the world, and we want to thank all the guests who have appeared on our show. In celebration, we have created an online store where you can buy Go to Health logo merchandise to show that you support evidence-based medicine and our Go to Health show. We've got t-shirts, muscle shirts, hoodies, hats, mugs, and water bottles in a variety of colors, as well as tote bags and magnets. With all the health misinformation out there these days, you can wear these and use these items to show you support evidence-based medicine and Go to Health. Just visit our store on the web at gotohealthmedia.com/store. Thanks again for all your support. We just love what we're doing, and we're so grateful you appreciate our efforts. Again, you can view and purchase these items at gotohealthmedia.com/store. On now to the 2nd million, and back to our show. So you keep mentioning puppies, and I know they are the most susceptible, but it really is important to keep getting the vaccine throughout your dog's life, right?
Yes, Jonathan. Yes. So dogs of any age can be susceptible to parvo, even our adult dogs and those older, more geriatric dogs that may have other underlying diseases that suppress their or weaken their immune system. They can also be susceptible to parvo. So it's important to look out for those signs and symptoms in any dog.
Got it. And I want to say from personal experience that I know how deadly parvo can be because the owners that I bought my dogs from, they lost a whole litter to parvo. I mean, totally
Oh
wiped out.
no.
So this is really pretty serious stuff we need to take care of. So
Yes.
there is a track map that Elanco, Elanco, that Elanco provides on their website. Tell us about the Parvo track map. What is that?
Yeah, so the Parvo Track is the first tool that we have available to help monitor outbreaks of canine parvovirus. So, unlike common human diseases, like you mentioned, measles, that have more formal reporting tools, there hasn't been a formal reporting tool for parvo in veterinary medicine. So,
Mhm.
the Parvo Track tool allows veterinarians and pet owners to identify outbreaks of parvo down to the county level. So
Wow.
owners or pet parents can sign up for alerts to be notified if there's an outbreak in their area. They can also report cases. So if they unfortunately do have a family member or pet that it comes down with parvo, they can report that so that everyone else in their community is aware that parvo is there in their own backyard. They can find that tool on stopparvo.com.
Good. I'm glad you mentioned that. I was just going to mention that website. So it's
Yeah.
Stop Parvo, stop, and then Parvo, stopparvo.com. So, Chris,
Yep,
before
that's it.
we end, tell us what mistakes or misconceptions do people have about their dog's health that they should know about before we leave today?
That's a great question. And there's a lot out there on the internet. And so one of my take home messages is don't always believe or rely on Dr. Google. If you're concerned enough to be using Google to search signs and symptoms, you should be concerned enough to actually reach out to the real doctors. Call your local veterinarian or get your pet seen by your local veterinarian because they are by far your best resource for all things medical related to your pet, not just dogs, but cats or any other pets that you may have. So if you ever have concerns, please reach out to your local veterinarian because they are by far the best resource for all that information.
Great. Wonderful. Thanks so much for being with us today.
Yeah, thank you, Jonathan, for having me and helping to spread the awareness of canine parvovirus.
Our pleasure. So, we've been talking with Dr. Chris George. He's a veterinarian and medical affairs specialist at Elanco Animal Health. And you can go to stopparvo.com to learn more. Chris, thanks so much for being with us. I know so many of us own dogs or even cats, pets. They're so important in our lives, and we want to keep them healthy.
Yes, absolutely. They're definitely a major part of our families.
Great. Thanks for being with us today, everybody. We're glad you're here. Remember, you can watch us on YouTube, you can listen to us on 8 podcast networks, and you can also subscribe to us at our website at gotohealthmedia.com. Thanks for being here. We'll see you again next time. Take care, and as we say at the end of every show, go to health. Bye-bye. We'll see you next time. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.